Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
I'm just kidding. We're live right now. Live on tape. Welcome to the Thunderdome.
Is that live on tape? Is that like Jumbo Shrimp?
Yeah. A little bit
Military
like
intelligence, mental health professional?
A little bit like that.
Okay.
But
I feel better already.
We have a very special guest today. But first, I want to start with our moment of Zen.
Oh, wait.
I mean, mental wealth tip. What's the difference?
There it is, our moment of Zen. The mental wealth tip today has to do with a sort of a translation of what Einstein is supposed to have said, that if you repeat something and expect different results, that's a definition of insanity. No, it's actually a definition of child conditioning. We repeat what we know. We live in patterns. So in order to have a different result, we need to break the pattern. And that's your mental wealth tip of the day. So I hope you feel a lot richer now.
Thank you, Sticky Ricky. And now, without further ado, we have a special guest today, an expert in what we call brain training and maybe neurofeedback as well. The one, the only, Mr. Burt Bacharach. Oh, wow, this is awkward. Oh, we couldn't get Burt. Well, who the hell is this? His brother?
Look,
the wrong guy. Okay.
It was all I could do. It was short notice. Now, come on.
Okay.
Give him a break.
Is this thing on, Mr. Bacharach? Welcome to the show. Welcome to the show.
Thank you. You actually hung in there. This is Nicolle Bacharach.
Whew.
Similar, close, no cigar, but similar.
I bet that's the first time you've had that reference in your entire life.
Today, it is the first time today. We're
today.
A dying breed who know who we're referring to when we say Bird.
Yeah, you're really, there aren't that many, there aren't that many of us still alive.
Check and mate.
Okay.
So we have an excited audience, between my mom and then I'm pretty sure maybe one of my third cousins also watches the show, but they're very interested in biofeedback, neurofeedback, the whole concept of brain training as it relates to consciousness and our ability to influence, control, manipulate, target certain states, all for the non-ordinary mind. Cue graphics.
Do we have, oh, okay. I thought this was for non-ordinary mind, but okay.
All right, and now for a moment from our sponsors.
Oh, nice.
Okay, Nicoll, please.
Where can I begin?
What got you into this field and what is it?
What it is an opportunity for the brain to reference itself. What got me into it was my father. He had Parkinson's, developed Parkinson's-related dementia. The only thing that we found that worked was neurofeedback. And I recognized with the restoration of my father that this is something that I needed to get involved in. I was working in breath therapy before, and this gave me access to the work that I knew I wanted to do, but wasn't certain how to get to. So when I say it's an opportunity for the brain to reference itself, plainly stated, so electrodes are placed on the scalp. Information is fed from them to a computer, and that information is the electrical impulses of your brain, and the information is fed back from the computer to you, either through your eyes or your ears or both. And your brain changes its behavior based on the interaction it has with the computer. Biofeedback would be electrodes placed on different parts of the body where those sensors are reading electrical impulses coming off of muscular tension. That feedback gives you a chance to recognize a part of the body that's tight. In this case, it's the brain. And you are only peripherally involved. You are in your prefrontal and frontal cortex. And those two cortices aside, the rest of the brain is doing a whole bunch of stuff to support our experience of life. Sometimes with our help, most of the time without our help. Neurofeedback gives your brain a chance to reference itself. your brain, not just the parts that you can get to.
So I've always wondered this part here, why is it that we live here, that our awareness lives here? Like for most people, when they close their eyes and you ask, where are you? Point with one finger.
Yeah.
They don't point to their chin. They don't point to the top of their head. They don't point to the bottom of their foot. Most people feel like they're right here. Why?
Number one, I don't know. Number two, we have been able to identify that character and personality as we understand it exist. What differentiates me from you, from Richard, from the man in the moon, from my wife, from my dog, from my son, is here. I like vanilla. I don't like liver. Exists here. Once you get beyond this, the brain is very active in supporting our entire experience of life. However, what you like and what you don't like, the rest of the brain doesn't really care about.
So kind of, could we say the ego is frontal lobe or prefrontal cortex?
They're part of the show, sure. I think trying
Conscious
to
versus subconscious.
again, sure.
Are you always disagreeable, sir?
What I recognize is here's everything the brain does. Here's our entire experience of life. Here's everything else the brain is doing that we're hopefully blissfully unaware of. So when we describe something, we're trying to put it over here in what we understand, what we think. And it's trying to describe something that's beyond description. So ego, sure. The id, sure. I think it's impossible to describe everything that makes this what it is. And the divine storm that we see when we place electrodes on the head and watch that, which composes your entire experience of life, is fascinating. The really neat part about it is watching someone's experience of life change before their eyes.
Yeah, and I kind of wish we could have demonstrated it on the show, but like a demonstration, the way I'm picturing it is I get some EEG, maybe like a swimmer's cap or something really cool, something sexy, you know.
You got it. Well suited to your eye color.
Right,
exactly.
right. Something that really complements my peepers, and then it gives you this baseline, what you refer to as brain mapping on your first visit. And then you use a computer interface, right, to both try to change the EEG. You're connecting kind of two parts of, I guess, the brain that wouldn't normally be aware of each other.
For example, sure. Let's say we're training, let's say we're doing an eyes open design where you'd be wanting to manage executive function, specifically the ability for the brain to focus on a task at hand, not to the exclusion of all else, but simply to focus. So you'd be working here. You'd also be wanting to work in the left frontal, you'd also want to work in the right parietal. Think of the right parietal in this case, kind of like the guy or the gal, the person at the end of the tug of war line, the one who we wrap the rope around, who you know is going to be the anchor and no one's going to move us. That would be this part of the brain when you're focusing. So we would train these two parts simultaneously. What it looks like is I would give the individual a video to watch, something interesting, but not arousing, not concerning, something engaging, but something that doesn't put you on the edge of your seat and, oh no, what's going to happen next? And while they're watching the video, for example, the backlight of the video will dim. They'll still hear the activity, whatever the audio is in the video, but the light, the backlight will actually dim. And it is this portion of the brain or this portion of the brain not performing according to the parameters that we would have expected. And when the brain does perform, the feedback that the brain gets is the screen gets lit again. We call it training because it's a series of repetitive actions so that the brain finds its way to, oh, I like this experience of life. Likelihood of being able to achieve that and keep it after one session, you probably need repetition involved in that, much as
Hence
you
the
pointed out before.
training part.
Thus.
Well, as a person who's done this, it's kind of a remarkable thing. And I don't know if you were going to talk about the different brain states, Nicoll. You don't actually think about it. It just kind of happens.
Correct.
You know, and I found that I could get to certain brain states very, very quickly once I had a few sessions under my belt. And I will say the first one, the typical first visit, I don't know if there's a typical first visit, but my typical first visit was like being on LSD or something. I came out of it so stoned. I was stoned for a couple of days
Mm.
afterwards. And I think my brain was just enjoying being free of my conscious mind, I guess. It was pretty impressive. Yeah, bravo.
Does this have any application in rehabilitation? I seem to remember, people with brain injuries, this was a very powerful tool to help them retrain all
Yes.
sorts of functions, right?
Yes.
Tell us a little bit about that. A little bit about
Well, I've got a current client who's a prime example. Tumor. Not big, about the size of well, not small. About the size of a Jack's ball. No, about that big. Big enough back here. So the surgery to address it rendered her with what we would basically describe as a traumatic brain injury as a result of, pretty severe trauma that is invasive surgery to the head. And consequential loss of hearing in her right ear, balance ruined. Careening into walls. She is now taking tennis classes. Oh, she wasn't a tennis player before. Balance is the one thing we haven't been able to restore yet is hearing. She's got there's a mechanical issue there because a portion of the brain was removed. However, the brain can be, it's kind of cool to think the brain can perform a workaround, and what she is aware of now is sounds, not what we would identify as hearing, but static, and it's progress. So traumatic brain injury, it's ideal, whether the trauma is as a result of a car accident or a surgery. The brain's primary function is to keep itself alive, not to make us smart, attractive, or popular. Sorry. And it does so by ensuring a consistent and adequate flow of blood and oxygen. Any and everything that the brain encounters that threatens that consistent and adequate flow of blood and oxygen, we define as stress. Some of those stresses the brain ameliorates over time and goes back to the way it was before. Most of the time, it doesn't, because remember, it doesn't really care about you being happy. It cares about consistent, adequate flow of blood and oxygen. So some of those stresses, traumas that the brain encounters, whether they're physical, mental, emotional, spiritual, or otherwise, don't rectify. What neurofeedback provides is the chance for the brain, as I said before, to reference itself, and then if it so chooses, change those frequencies. 9 times out of 10, it will. What Richard described as it being an easy experience, to me, and I'm speaking from a very narrow perspective of, I think, what the two of you work in all the time. To me, what it looks like when someone really gets it is they let go. And of everything. What you want, what you expect, who you are, what you think, where you are, and what matters. You let go of everything. And the brain is given a chance to change.
Isn't this analogous to kind of like a deep ego dissolved yoga trance, or we did a show on chanting last week, and or really deep meditation where you access this spot? Are you doing that electrically?
Yes.
It's pretty cool.
That's awesome.
Can you talk about the different brain states that you can access with the neurofeedback?
So I'll define, if I may, in thorough but brief, an outline of what we speak of when we speak of neurological function. And conveniently, both of you guys professionally use the same terminology that I do. I just get super technical about it just because I'm an electrician, basically, in this case. So from 2 hertz to 41 hertz looks like normal neurological function for a human being. We break those hertz, and hertz, literally the same hertz as you would use to measure the light that's illuminating my face, or conveniently the same hertz that you would use to measure sound. In this case, we're using it to measure electrical impulse. 2 to 4 hertz, delta, basic bodily function, autonomic nervous system, digestion, respiration, generation of electromagnetic field, blah, blah, blah. Nothing that you'd ever be aware of. 2 to 4 hertz delta. 4 to 6 hertz, or excuse me, 4 to 8 hertz theta, depending upon where in the brain we're speaking of, unconscious, subconscious, or intuition. 8 to 12 hertz alpha, presence, nowhere to go, nothing to do, just to be. But again, it depends on where in the brain we're looking. 12 to 38 hertz, big range there, 12 to 38 hertz, the betas. Low beta, 12 to 15, beta, 15 to 18, and then high beta, 18 to 38 hertz. So those are all the doing frequencies. I'm thinking of what I'm going to say now. Took a breath, I'm flapping my hand. You're both listening to me and you're understanding what I'm saying. You just blinked, you just blinked, you're both aware of it. Yeah, the betas, they're all doing frequencies of one form or another. Then at the top of the frequency range, 38 to 41 hertz, Richard likes this frequency.
I like it a lot.
I like it a lot.
Gamma would be, so everyone in medicine will call gamma a binding frequency. They'll say it facilitates in transitioning from one brain state to another. You could think of it like oil in the engine or egg in the cake mix. Too much oil and she doesn't go. Too little oil and she doesn't go. Too much egg and you can't get the fork in. Too little egg and you got no cake. Then there are a few people who would say that we think gamma does something else as well. And
ESP?
Among other things.
a binding frequency, possibly to not here, not now. Hard to define it other than not here, not now. Everywhere, all the time.
Well, the fascinating thing for me as somebody who went through this, and that kind of seems to be my role on the show, is to go through stuff, was after a few sessions, I could actually connect with gamma before Nicoll turned the thing on. As it would turn on, it would start pinging that I was already in gamma. I got pretty good at it, although it's possible I just lived there. I don't know.
It wouldn't surprise me to understand that you do. A great expression of gamma, as it was explained to me years ago, I date myself with this reference, was Michael Jordan, when you would watch him in the middle of heading up for a layup and supposedly his tongue is loose in his head. A great example of gamma expressed is the tongue becomes loose in the head. Another teacher I had early on explained to me when people are speaking in tongues.
Oh, wow.
Yeah.
Fascinating, fascinating.
We
So
talked about that in the show before. It is fascinating.
So what we would recognize as a result of your asking about brain states, Richard, is those brain states that we reference, delta, theta, alpha, the betas, and gamma, you want different expressions of them in different regions of the brain, depending upon where we're looking and what's going on. Mark, you referenced a brain mapping that I would do with someone when we first meet. So the mapping gives us a snapshot of what the brain is doing in each of those regions. It's just a snapshot, but it gives us an idea of what's going on and where.
But it's an electrical snapshot, correct? Is it
Correct.
like a picture or a state, or we're looking at just the electrical output, like different brain states, brain waves?
Correct. Thank you. To be clear, so the electrodes are placed on the scalp in each of the different regions that we're checking out. So frontals, centrals, temporals, parietals, and the midline. And we map each of those regions in 3 different states of awareness, one with your eyes closed, one with your eyes partially open, and one with your eyes open, where I would have a task for the individual to perform. I'll have them read a passage out of a book or give them basic mathematical problems to compute, just so we see what the brain does in those 3 different states. It's not how the brain is all the time, but if they're coming in because they've got a complaint, I can't sleep. You know, I plow the back 40, I play chess against Kasparov, I pray my heart out. I go to sleep when my circadian rhythms tell me to. I move into my sleep sanitized environment. It's completely cool, completely dark. It's ideal. And the second I close my eyes, my executive assistant comes running up with their clipboard. So glad you're free. I have just one thing. And now it's 4 o'clock in the morning. I'm staring at the ceiling going, really? It would be an opportunity for us to look at regions of the brain. And I'm suspecting when someone tells me that, we're probably going to the parietals, and to see that, oh, look, you shut your eyes and the betas push up. They want to do, and that's exactly what they're not supposed to do. So we would then give the brain a chance to go, hey, parietals, look what you're doing. An example I use, you've both heard this, I laugh at my own joke, it's terrible. An example of this and why we don't necessarily fix these things sometimes on our own is the joke that you may have heard about the guy who goes to the doctor and says, "Doc, I don't know why it is, but every time I drink a cup of coffee, I get a pain in my eye." And the doctor says, "Well, did you take the spoon out of the cup?"
My favorite joke.
You
This-
would take the spoon out if you knew a spoon was there. If we're talking about a region of the brain that's not in your prefrontal or frontal cortices, it's kind of hard to flex 10.5 hertz if you don't know what it feels like. Thus training.
In training comes entrainment, really, right? And you're teaching the brain electrically how to access these different states.
Yes, and a word that it looked like your mouth was getting ready to form, and I was going to get excited if you did. Neuroplasticity.
Yep, that's what I was going to say.
Because
wait, which word?
I love you, brother. Neuroplasticity. The more so it's the most plastic part of our body. It is the most dynamic in its change, and like everything else, it's habit formed. And the more you can break your brain out of habits, and the best way to do that is to teach it a new language, whether the language is music, hello, or another literal verbal language, or a skill or a trade that you would take up. But learning something new, completely new, immersion in the new keeps the brain young, keeps it plastic. So does neurofeedback.
Can you use your powers for evil? I mean, is this something that the military would be interested in some sort of a torture? Does this teach us about pathological electrical states of the brain, like, oh, doing this behavior or consuming this or exposed to that? Do you actually get to see the dark side of electrophysiology? And you weren't ready for that question, huh?
Not like you all do. I don't get doorknob disclosures where someone is getting ready to head out, and as they're leaving and we had a great session, they turn and look at me and they go, "Oh, I used to strangle cats as a kid. I'll see you next week." I don't get that. I don't get that.
I get that all the time.
Did you say something?
What?
So what I do get is I get someone who would like to be other than who they are. And the nice thing about neurofeedback is you most completely become yourself. One's brain, me and my identical twin have I don't have a twin, but if I did, we look identical, but our brains are completely different. One's brain function is as unique as one's retina, as one's thumb print or any other print. There's no replication of it that we know of. Through neurofeedback, you more completely become yourself. So if you happen to be a pathological sociopath, yeah, that may be what blows up in you.
You knew that? You can see that?
Only because I love you like the brother.
You haven't even put the electrode on my head.
So, well, right. And he's going to keep his covered so nothing gets to him.
I have a tinfoil one in the corner there, but I don't want to get off camera. What about spiritual experiences?
Oh, yes. We talked about this before the show.
When I got started in this, my list of things that I understood I would be addressing would be anxiety, depression, athletic performance, academic performance. Like I say, my father had Parkinson, so there was a physical tremor and dementia, and I figured it was all the stuff in that world. I've got a list of complaints that I can go after. So I set up shop initially in LA, and my first client ever, I had gone through some training and I understood what I was going for. As we sit down and I'm gonna, I've got my head ready toward this list of complaints that she's gonna give me one of, and I'm gonna go, "No problem." And her first words are, "I would like," and I quote, "I would like to perfect my connection to my source."
Mm-hmm.
And anxiety, no. Depression, no. Athletic, and I say, "You want to get close to God?" She goes, "Uh-huh." And I'm thinking, I don't know.
I mean,
okay.
The neuroscientists say God lives in the left angular gyrus. So, this is an area you can electrically stimulate during brain surgery, and people will have a religious experience, and sometimes even
I was listening to a lecture on the default mode, and I called Nicoll up and I said, what do you know about the default mode? He got very quiet. And then he said, you
Are we gonna get
were,
censored for this again, Rich?
what's that?
Are we gonna get censored for this? What you're about to
Oh
say?
no, it's not dirty.
I hope so. Anyway, so he said, well, yeah, that's where you process, you know, sort of, I forgot what you said, the holistic or some, well, you could say it. I said, well, I'm listening to a guy talking about LSD. And I'm wondering if can you tap into that? Have you ever done it? And he says, no. I said, would you like a guinea pig? He goes, so that I, of course, became the guinea pig, and it was freaking amazing.
Yeah.
I mean, it was like a shamanic ride down these different tunnels of experience, and with all kinds of religious symbols that I didn't conjure up I mean, it was some part of me must have conjured them up because I was in the middle of it. And when I finished, I said, well, why did you turn it off so soon? He said, what are you talking about? We've been doing this 45 minutes. I said, you got to be kidding me. It couldn't be more than a minute and a half.
Yeah.
At a complete time distortion of the experience too. It was truly beautiful, actually.
That letting go that we spoke of before.
But it was a different kind of letting go than I had had in other sessions with
it was
you.
sort of like a temporal discontinuity, and I've experienced
Absolutely.
that from yoga. Interestingly, when I was not too fat to see my toes, but I've had that experience where, you know, you're in maybe an ego dissolved state, and then what like you just said, a minute to 5 tops is really an hour.
Yes.
What is your understanding of, one, can you target that? Can you replicate that? Or is that even figure at all into the goals of your therapy and treatment? And part Roman numeral 2, subsection B of that question is, what does it all mean, Basil?
I think the meaning is up to you. I think the to answer your first question, can we? Yeah, it happens pretty much every session with someone. I wrap up with a design called alpha gamma synchrony in the left and right parietals. It's an eyes closed design, and the end user's assignment is to let go, notice their breath, you know, let their attention fall here. If they're comfortable, and here's a hot tip for everybody, by the way, to enhance your stillness practice. If your eyes are open, great. If your eyes are closed, fine. But eyes opened or closed, try, quite seriously, looking with your eyes at this point while you're in your practice. Eyes closed, no one's going to know. Eyes open, just make sure no one's looking at you, not wondering what you're doing. But literally, have your eyes do this.
That's going to be the thumbnail for our show right there. Just
beautiful.
So you know.
And thank you. and the other thing is, I asked
already.
Well, yeah, he already screen capture. Oh my God, I'm getting it. And the other thing is, I ask the individual to notice the tip of their tongue and where it rests between the teeth and the upper gum line, and just notice that pressure. And to finally be attentive to their breath. And by that, the tide in, the tide out. We run that design for, on average, 20 minutes. Invariably, the first couple of times I run it, oh, wow, how long was that? It was about 20 minutes. Nuh-uh. Yeah. Oh my gosh, that was like 2 or 3 minutes. No, it was 20 minutes.
That part fascinates me because to me, that is, my assumption is that correlates to some targeted state, obviously a deep state, but very rarely does the brain shut off its chronometer. I mean, everybody has had the experience.
It stops mattering. It doesn't shut off. It just stops mattering.
It stops mattering. Okay, I like that. But you know, even when you're asleep, it matters. Your brain will wait. If your alarm clock's set for 7:30, your brain wakes you up at 7:29. How?
This ain't sleep. This is it's so difficult to define, but I've called it going away. The body stays in the room. They're not there.
Yeah, but the mind is not local. The brain may be local, but the mind is not local. I mean,
how about that? And it is set free. Yeah. that is released from the bounds of this physical means of transportation in the physical
Yeah,
world.
I read a book once called Stalking the Wild Pendulum. And it was, I don't know if you ever read it. Itzhak Bentov was brilliant. He's a physicist. He's gone now, but so what he said was really fascinating. He said the pendulum is going to go like this, and if you track the movement as it reaches the end, it slows down
Yeah.
and stops. He says, well, what happens right before it stops? One over infinity distance. Okay. Well, at 1 over infinity distance, rate times time equals distance is meaningless. And that what happens is that you're everywhere in the universe at once.
Yeah.
And his hypothesis, which I thought was just incredible, was that that's what psychics do when they get information, or what people do when they connect with the collective unconscious.
Yeah.
They're in that special zone where they're accessing the non-locality of mind. And I just love that idea. Yeah. That there is that it puts the brain in a space where it's connected to that non-locality of mind, and you can access anything. And I experienced something like that when you hooked me up with in the default mode. Although I'd experienced it in other places, other places that you connected me to, but not as much as that one. That was a special experience. It was really beautiful.
Mm.
What's been the most bizarre or intriguing response that you've seen out of?
You're supposed to say besides Rich, right?
Well, no, while doing the treatment. Not who's the most bizarre person you've treated, but like what has happened during the treatment that you didn't anticipate?
At the end of a session, so there's a couple ways to look at that. So one of the, to be clear, training is the success of training is something that's done over time. So the general number of changes that I'm looking at are things that occur over time. Great example being the individual I cited before who'd gone through surgery and as a result had no balance and now is playing tennis. However, after one session, I've had a couple of interesting little anecdotes of things occur over time. One was, so I never charged for an initial appointment. It's never felt right, fair, or appropriate to bill someone to learn about me and what it is that I do. And at the end of it, I'm going to talk about neurofeedback. I'm going to describe it, but it's so subjective. It's like trying to describe what the color blue tastes like, or what it feels like to snuggle up on yellow. So I say to the individual, look, if you'll let me, let me give you an experience of it, then you'll leave here knowing what it is, and then you'll decide whether it's for you or not. And so I do the same thing with everyone, and it's a quieting of the parietals, and it's first cousin to the alpha gamma synchrony design that I mentioned before, and we all benefit from it. So I do this on this gal who's she's in sales, and we met because she was trying to sell me, and I wasn't interested, but she's like, so what do you do? And I told her, and she's like, it's interesting. I said, well, come on in, and I gave her an experience. So we did that for 20 minutes. At the end of it, she sits up and she says, I'm really sorry, but I have to excuse myself. It's almost 4:30. I'm sorry, I have to leave. And she bolts. And I'm like, what the heck? That was weird. And I wrap up and, I'm done. And I go through my end of day notes and I'm getting ready to leave. And I get this call on my phone and it's her, and I answer. And she's like, I'm so sorry. I had to go. I had to call my broker before he closed up. I had an epiphany because of the session that I just had with you that I needed to sell part of my IRA to pay off my debt because I am quitting my job tomorrow morning and I'm moving to Hawaii. And she did. So that's an example of something I wasn't expecting.
So that was kind of that's really interesting, kind of what I was getting at. Because sometimes some people, usually younger, have like, have a spontaneous out-of-body experience if enough of their brain that's working on assembling consensus reality is paused, diverted, slowed. Epiphany is actually kind of a better outcome, I guess, than like an out of body experience. But the first time that somebody experiences that timeless state, that may be the first time in their life that they've ever experienced that.
And that you describe it as that timeless state, I think gets to where the three of us want everyone who we have the opportunity to work with to get to, because in that weightless environment for just a moment, the isness that composes us, whether it's our gray matter or our non-gray matter, has a chance to, for just a moment, reference itself. And in that moment, make light years of change. Let go.
You know, I bought this hat because of Tom Petty, actually, and I want to tell you a little story because it is so on point with what you're saying. I was at a concert and he's playing, and I love Tom Petty. See, the band is playing some kind of bluesy thing, and he would have liked that cup, by the way. I think if he was alive,
The colors, the colors,
he would have bought a bunch of them.
the
Put them
colors.
on the album cover too.
Hey,
Anyway,
if anyone leaves a comment, maybe we'll send them one.
we'll send him one.
Positive or negative.
What he says though,
I'll get right on
is
that.
now calming down, and he's telling the story about some psychic that he goes to, and she asks him what he wants, and he says, "I want for 1 minute for everything to be all right." One lousy, and the place goes nuts. 20,000 people, absolutely roaring, and he's playing it. One lousy minute, one stinking minute, that everything would be all right. And I think that's what you're describing.
Yeah, shifting consciousness.
You know, it was, and that's before I met you, but as I experienced the brain training, yeah, that's what I went for. I wanted that. It was more than a minute that I was outside of myself. It was really incredible stress buster. You know, because I get, once in a while I get a little wound up.
Yeah, but rarely can you therapeutically or safely or consistently recreate that vacation from yourself. And for different people, different ages, whatever, maybe different neurogenetics, different things work. So like yoga might be much more grounding than Tai Chi, or maybe performing music for someone else. Where does this type of brain training fit in? In other words, is it sort of like hypnosis, where there's some people are just really good at being hypnotized, or is this more analogous to something like TMS, the transcranial magnetic stimulation, where it really doesn't matter what you believe, this is going to turn on neurons and get these tracks talking? Or
a little from column A and a little from column B. You asked before if government agencies are working behind the scenes with it. So actually, I'm not affiliated with either of these organizations, but I'm happy to say. So the Department of Defense, the DoD, has been using neurofeedback for, about 20 years now. And NIH, the National Institutes of Health, has been working with neurofeedback for like 22 or 23 years now, in both cases for working with people who don't, wait for it, tolerate, hold on, pharmaceuticals. And to deal with, with DOD dealing with people coming back from conflict who've got PTSD for one reason or another, and they can't tolerate the meds. Yeah, it works like crazy. In terms of the application to give someone hands on their life, in a sense of a direction. Let's say you're working with, let's take post-traumatic stress disorder just because it's right there. What the brain is given a chance to do is, and you, the end user, will eventually have a sense of what that feels like. It'll not generate the frequencies of electricity that cause that distress. Now, it's not going to be invasive in the way that frequency is going to be manipulated if you actually place something on the scalp that is generating an electrical frequency and encouraging the brain to pick it up. This is suggested. It's not invasive. The brain isn't made to do anything. There's no coercion. You and your prefrontal and frontal cortices have to choose to let go. You got to choose to not flap around in the chair. You got to choose to have your eyes open and not blink, 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 blink. You got to choose to participate in the process. If you do, if you let go, and the more you let go, the brain changes. The more it changes, typically the end user is happy, and that equals, as we spoke of before, a consistent and adequate flow of blood and oxygen, which means if you're happier, you're going to get more consistent, more adequate flow of blood and oxygen. You'll do it more. So
I like that. We here at Alternative Psychiatry um, always are looking for the non-pharmacological interventions. And let's just talk about bread and butter stuff like depression and anxiety.
sure.
How, either because someone's treatment refractory towards drugs, or drugs clearly aren't the problem, pharmaceuticals, or they just don't want, they just don't want that, which I see a lot of people that aren't interested in that at all. And there's a lot of other therapies, and we've talked about them all on the show. I kind of want people to understand specifically how, let's take both depression and anxiety. How would you set that person up? You do the mapping and then work to treat depression. Like, what's the electrical correlation to it?
Well, so there's a somewhat holistic approach. As I shared before, I view the world as boiling down to a chemistry and electricity situation, with physics being the driving force between those two. And seriously, if you can look at it scientifically, so if I'm working with electricity, it's going to be impacted upon by the chemistry, and that's going to be what the person puts in their body, whether it's in the mouth, in the nose, however it's getting into your body. That chemistry is going to affect neurological function. Let's say someone, sure, they've got anxiety. In my intake, we're going to look at their eating, sleeping, exercise, and stillness practice. Their habits, what they eat, when they eat, how they eat, what sort of exposure to media, what time their day begins, what time their day ends, and what sort of physical activity they're involved in, because all of these things affect neurological function. I'm preaching to the choir here, of course, but that becomes part of the intake. Then we're doing the brain map, which shows us what's going on and where. And typically, if you've got errant frequencies of electricity which are going off somewhere and causing what we'll describe as that anxiety, getting that under control, you can oftentimes get a hold of as well by having the person look at eating, sleeping, exercise, and stillness practice habits in combination with neurofeedback,
in order to directly measure the effect of those interventions.
Yeah. And I'll ask the person to note at the end of a session, how they feel. I'll ask them to note how they feel before. And we will accumulate this subjective experience that they have. They won't come in because someone else said gee, you seem anxious. People come see me because they don't feel well, and they would like to find something that will help them to feel better.
We do a lot. I'm sorry, go ahead.
No. As a result of feeling better, you note, gosh, yeah, because I'm not as anxious. How did that happen?
Nicoll and I did some work together on trauma patients, and it was quite fascinating.
Yeah.
He would be watching the brain function, and when it would reach a point where you could see the patient was accessing the trauma, it was fascinating. He'd be able to back it off, and I would dialogue with the patient at that moment. And we actually even had medical intuitive on a couple of those meetings that were Adrian, quite amazing meetings. Nicoll, do you encounter trauma stuff a lot? Not personally, I mean, but
we've all got something.
How do you conceptualize it through the brain?
So another way of looking at what the practice of training your brain could be described as, since we're not going to uncover the diabolical mastermind criminal genius if that person isn't there. If you more completely become yourself through neurofeedback, we could also look at it as peeling away onion layers. When you peel away a layer of onion, there might be something there that they didn't know was there. I've had a session finish where I bring the lights up and the person's got tears flowing out of their eyes because they're now thinking of the pet they buried when they were 8 and they had never dealt with that trauma. It happens. Sometimes
I was in on one of those sessions with that young man who got the memory of being molested as a 5-year-old.
Yeah.
That I could never explain why this guy's life was so difficult.
Yeah.
And you know, the thing of it was, he came out of the brain training crying, but he didn't say what he was crying about, and he didn't see me for 6 weeks. And then he came in and he changed his life. And it was pretty, he said, well, when, you know, when I met with your friend, I got the memory of being molested. I didn't want to tell you. I don't want to tell anybody.
Mm-hmm.
So I said, well, what do you want to do with it? He goes, well, I need to tell my parents. He was about 18, 19, I think. I don't remember, something like that. Late teens, early 20s. So I brought the parents in, and it was the key moment for the rest of his life. They rallied around him. It was really beautiful. And I started talking to him again. He's out west somewhere now. And I called the wrong number, and I got his mother. And she just started talking about that day and how much it changed his life. And you know, but so that's feedback actually for you too, because I don't think without the session with you, he would have ever gotten to that material. It was really profound. The other thing, Nicoll once said something to me that I don't think I would have gotten without this process. He says, you know, Rich, you're sort of a neurosurgeon in that you have to peel back the spiritual experiences from the trauma, which are encoded very similarly. And I know great lines when I steal them. I mean, when I hear them, and I've used that line a lot. You know, that is the job.
It's true.
That
It's
is
both of you. You think about it. It's both of
I
you guys.
call you a psychic surgeon, but neurosurgeon, whatever. That's fine.
I always thought that you said I was a Jedi mind. I did Jedi mind tricks.
Jedi mind tricks, yeah.
Yeah, that too.
I got another question for you. The EEG, is it just looking at cortical activity or subcortical activity, deep brain structures? I probably should know the answer to this, but I don't.
Oh, okay. I thought you were setting me up. Yeah, no, it's just looking at cortical and subcortical. You can get a sense of the more profound activity, but there's so much happening on the top of the hive. You know, and by the way, much of what's on the surface of going on there has deeper corollaries. So if you're seeing errant high activity, chances are good it's going further inside that mass. Perhaps the wrong use of the word mass, nevertheless.
Well, the other thing that confuses me is I think generally people know about brain waves. They may not certainly know the different states and the frequencies and everything, but they understand the concept of brain waves. And I think erroneously people think, oh, if let's just say I'm in beta, they erroneously think the entire brain's in beta. And that's not true. I mean, there are certain regions of the brain that might be operating at a different frequency. How do you tease that out? How do you separate that out?
The studies that we have all been involved in, we the species of human beings, since we realized that there's something going on up there that's super complex, break down into super specific regions that are responsible. The broadest thumbnail that I can offer would be this. So prefrontals, frontals, personality, executive command. If we have a computer or a calculator, no emotion, the happy accountant, right here. The brilliant artist, tortured and going to create something fantastic, right here. Physical awareness, physical body, right here. Memory, speech and language, oral, that is to say sound processing, right here. The parietals would be not here, not now, not in your body, not in your personality. And then the occipitals, right at the backs of the head, we would say 90% of their job is the processing of light. That broad thumbnail would also tell us you want, by and large, betas on the left side, alpha on the right side, betas in the front, alpha in the back. So alpha is presence and being, betas are doing. You want more doing in the front, more being in the back, more doing on the left, more being on the right. You don't want to pour gas on the creative artist, otherwise they're going to wind up going and being super unhappy. You don't want to make your active side just sit down and have a massage, because then nothing gets done. When something's wrong, when something's out of balance, when someone says, oh, I function best on beta. Yeah, no, you don't want beta globally, but what they're probably referring to is they've got a nice, generous expression of beta, primarily low beta, happening in the left frontal. They probably have a little bit of low beta happening in their right central, antithetical to what we would normally think. But the central cortex, the right central cortex, we also think of as the sensory motor cortex. And here, that low beta, 12 to 15 hertz, we think of as the sensory motor response. And it would be that awareness. Oh, I might need to pee in a little while. Gosh, dinner in a few hours. What would I like to have? That sensory awareness. You know, I feel like I could do well with going for a run, that sort of thing. So when you speak of, or when someone speaks of an awareness of the frequencies of their brain, yeah, it's not a blanket global expression. It's different frequencies in different parts of the brain to support what that part of the brain does well in. I get it? They do it? Hot diggity.
I dig it. I dig it. I got 1,000 questions, but
Hit it.
Rich, why don't you hit them with a real hard one, really toughy.
I don't have tough questions unless
42?
I'm trying. What?
Life, the universe, and everything? 42, isn't it 42?
Okay. Do you work with addictions?
I do.
Not. Oh, so what do you do with that?
Tough
How do you?
question,
Okay.
easy answer.
Well, hang on a second. If when a person comes in, if they're actually using, can you still work with them at that moment, or do they have to be clean when they come in?
It's good and fascinating. So take it out of the realm of legal or illegal. Let's just say drugs.
Mm-hmm.
I worked with someone who was on 4 times the maximum adult dose of a pretty serious psychotropic, prescribed by a professional. Well, not you, but not, yeah, right. And
This guy.
so that way, and he wanted to get off of it. So we trained him to get off of it. It took a while, and the same applied to someone who was on 15 different meds, some of which were prescribed and some of which were inherited.
Okay. Good work.
And some of them were opiates. So legal, illegal, it's the brain on something. What I learned early on, and a colleague of mine and I, in pushing thoughts around, recognized, gee, it would be good to have that person who's on whatever they're on, go consult a physician's desk reference. Crack that PDR open and look at the side effects, all the symptoms of over-medication on that thing that they're on. Because as we train, they may start realizing that that medication is too strong. Now, if you're using something that's not prescribed other than by yourself, and you really want to get off of it, again, look for, oh my gosh, I usually have to take X to go there, and now it's taking half of X or a quarter of X. So can you be on something and train? Yes. Is it optimal? Probably not. But if the alternative to not being on it is you jump out a window, please stay on it. And let's...
Or just like you said, that's an extremely powerful intervention. If you can reduce someone's reliance on a tranquilizer or pain medicine, that is always the goal. Except doctors just hope that mysteriously their pain or anxiety gets better so that they can try to go down. If they're really aggressive, they get frustrated and force that person down. Rarely is there a discussion of complementary and alternative methods or techniques to get people off of this. Because let's be honest, most of the people that come to see me aren't naturopathic, wellness-minded people. They're people that have tried pretty much everything and failed, tried all of these damn pills, done the regular psychiatry rigmarole. So that's a tremendous thing. If you can decrease someone's reliance, that's an extremely hard thing to do. I mean, people will go up to Tampa and be put under anesthesia for 3 days to try to get off of meds. That's a heroic intervention.
Don't I know?
Neurofeedback seems like it's got just a wide range of uses and still a lot we don't know.
I'm mindful of how I present my understanding of it, because I recognize it could easily be misidentified as a panacea, or worse, I'm a snake oil salesman, and that scared the daylights out of me when I got started in this, because I thought I need to be squarely in the realm of science with this. And that's why the winning combination for me was my father. I knew who I brought to get his brain trained, and it was not my father. I knew who we had back 2 weeks later when I was dealing with someone who called me by my name and asked me how my wife was and asked me what my son was up to. And it's like, oh my God, who are you? It was great. And I realized I'm doing this. I didn't recognize the myriad things that could be addressed. And as you referenced before, so when we spoke before the show began, I don't know where the corner of the room is. I think what we would be exploring is what are the limits of our brain's functions. You know, we understand that an offshoot of transcendental meditation, Theta yoga, allows someone to, in a meditative posture, so in lotus, meditate with their eyes open. And the Theta yoga practitioners call what happens next hopping. And what we would say it looks like to the naked eye is the person's body defies gravity and they float in the air. And everything in my science head goes, that's not possible. That's baloney. I would use another term, but anyway, it's not possible, but it's happened. What makes that happen? How is that possible? It must have something to do with the brain. I don't know where the corner of the room is. I've had people come in with things they wanted to accomplish where I'm going, yeah, okay. We'll see what happens. I'm going to perform a brain map and we'll train like normal. And things happen that don't fall into that category of anxiety, depression, athletic performance, academic performance. And I also can't explain how those people find me.
Oh.
Yeah, go figure. I think when you want it, whatever it is, you're going to find the things and the people who are going to help you to get to it. Now, as it pertains to addiction, I don't want to go too far down that path, but it bears repeating here. You're going to get off something if you want to get off of it. You'll find what you need to find to get you off of it. If you're more interested in entertaining the experience of being on it, but looking like you want, yeah. So.
Well put. Well put. I think your passion probably comes from like your successes that with your own father and the treatment through that, and you can tell that you still hang on to that passion and caring for people and helping them in this way. And it's
such a gift to get to help. It's such a gift to get to play.
And it's not something that is commonly known. So that was we appreciate you coming on and talking about it. And our goal is to raise awareness and.
Thank you.
We'll certainly include your contact information in the link below here. I will put Jean-Luc himself on that.
Make it so, number one.
You hippie.
Don't you forget me.
Oh yeah, him too.
And tell me about your mother.
Now maybe we can have a part 2 on another
I'd be happy
show.
to. I'd be happy.
Wow. Yeah, Nicolle, you're the best. He really, talk about passion. He really cares deeply about not just the process, but about everybody who goes to see him. So, I trusted him enough to send my son.
It's the company I keep.
There you go. So, Mark, do we have somebody interesting for next time?
We do. I want to thank Nicolle for being here. We learned a lot. Like I said, his contact information is below. You can call our office and learn more about it and get in touch with him. But yeah, next week, make sure to join us. We are having the renowned bioethicist, Dr. Kenneth Goodman, on to talk about a little, I don't want to say controversial, but important bioethical implications of COVID and the way humans have behaved surrounding the pandemic.
Does that mean we're going to be off YouTube by the end of the next episode?
We probably are, but we're going to cover from masks to vaccines and all of the bioethical implications as a different facet of discussion about whether masks are good or bad, or masks are Democrats or Republicans, or vaccines are for everyone or no one, or do they carry microchips or baby fetal DNA? Those are the big questions. So join us next week.
I think I will. Oh, I get to do it with you, so I'm going to do it anyway. Anyway, everybody out there, all our non-ordinary mind people.
Remember, I don't think we rehearsed this with Nicolle.
Oh, you have to say "be well" when I hit 4.
It right now.
And what am I supposed to say?
Be well, but I already
be well.
1, 2, 3.
Be well.
Be well.
Be well.
Almost. Pretty good.
Keep working on it.
All right. Thank you, Nicolle. We hope we'll see you again real soon.
Thank you, gentlemen.
See you, Mark.
Thank you.